Okay, terrific.
So you'll get a lot of attention. It's just the two of you. Ask all the questions you want. Oh, Marcus.
Yep. Anyway, welcome. I'm glad to have at least two people here, and as Kathy said, we'll be able to answer all your questions. And Kathy's very up to speed on all the Complio stuff, much better than I am. So as soon as Marcus is joined us, I'm gonna.
Hi.
Very good. I'll turn it over to Kathy and let her discuss Complio, which is probably the biggest thing, and then I just have some informational things at the end.
Yeah, so Marcus, you're with us?
Yep.
Okay, great. So I'm the project specialist that works with the HIM program as well as a few others. I'm the one that, you've probably seen emails coming from, and I'll be kind of walking through all the Complio stuff with you. So one of the things that's really important, as you're looking at your co-op internships, is that, usually in the term beforehand, or at least within 6 months of your co-op, you need to do a number of things that are required not only by co-op sites, but also it's part of state law with health professions and doing co-op clinical kinds of internships. So there's a list of items that you will need to complete before you will be able to do your co-op. And that piece is important because if you don't have it done at the time that the term is starting, your co-op's going to be delayed. So it's really important to get this stuff done. I'm going to share my screen and I'll go over what I have here. Okay, so these pre-co-op requirements, this instruction sheet, I'm going to ask that you please read it thoroughly from top to bottom and understand everything you need to do. We've had some questions about, whether going through all of this is necessary if you're doing a co-op that's remote, and the answer is yes. So all of the co-op requirements, these are requirements that Oregon Health Authority, it's required by Oregon Health Authority for all health professions students. And it's also part of our clinical co-op contract agreements. So part of that process, and I think some of you have already started this process, and that's great. I'll answer any questions you might have. But so through the American Data Bank, they have a tracking system called Complio, and that is for tracking all of the requirements that health profession students all over the country have to do before they can go into clinical settings. So it keeps track of what you've completed. You upload your documentation to this system, and it's how you go through the background check and the drug and alcohol screening. So the entire package is $114. Most of that is for the background check and the drug alcohol screening. And then there's a $20 part of that fee is a $20 tracker that will allow both you and the program to see what your progress is in completing the requirements, and so you can upload your information. So background check happens automatically as soon as you've ordered it. And I'll go through a form that you'll need to do on that same day when you order it, because when you order it, you need to upload a pre-background screening form. And I'll go over that in a minute. The drug and alcohol screening, do this as soon as you can, because it can take a couple weeks to turn around and get results back. They will send you what's called a chain of custody form and tell you which lab to go to. You can only go to that lab. If you go to a different lab, you're going to have to redo it at additional expense. So go to the lab that they indicate and take the form with you. There's some things to consider as you go for the drug screening. One is, do not drink too much water ahead of time, because if the test is dilute, you're going to have to do it over again and at additional expense. The other thing to consider is that you cannot have a positive screen for marijuana. And I know that we all know that that's legal in the state of Oregon, but in health professions and in clinical situations, you cannot have a positive drug screen. So if that is something that you have been doing, you will want to wait. Well, if it is something you've been doing, especially recently, you're going to need to stop immediately, let it clear out of your system, and that can take 4 to 6 weeks. So be aware of that. So let me stop there, ask if you have any questions about the background check or the drug and alcohol screening or ordering your account.
One question, Kathy, that comes to mind related to another student. How long are each of these elements good for? Because we've had a few people that have taken the class and taken it incomplete and have to take it over the summer or what have you.
Right.
And so do these things have an expiration date on them?
Generally they're good for a year. So like Serena, if you were doing it next year, I wouldn't start this process immediately. I would wait until at least fall term to start the process. Because if we get too far out, you're going to need to do the background check and the drug screen over again. So generally it's good for 12 months. We don't want you to have to repeat them if you don't have to. Now these accounts are good for they will be there, and on a yearly basis, you would have to just renew the tracker. Okay, so this is something that you can use for medical documentation as you go forward, into your workplace. And if this is required, you can have access to this tracker. So, a pre-screening form, and I'm going to jump down to that. I'll come back to it. So that's important because it's just asking you if you have ever, if you have any kind of charges or something in your background that might come up in a background check. And we want you to be honest if that's the case. So there are a lot of things that come up in these background checks, most of which are not going to impact you, would not impact you in any way unless it's a serious, if we're talking a serious felony situation, that would be something that could be problematic. But for most things that I've seen come up in background checks, for any flags, it's not something that would keep you from continuing with your education and moving to this career. So, or getting certified. But we need you to be honest about any situation that might come up. You will also need to do a couple of trainings, an OSHA safety training and a HIPAA training. Those are both required. Because you're not working directly with patients, at this point, it is not necessary to do a bloodborne pathogen training, but if that's something that your site requires, you would want to do that. Vaccinations may or may not be required depending on your site placement. We're starting to get to the end of flu season. So often for spring and summer internships, the influenza vaccination is not required. It's mostly for fall and winter terms. But again, that's something that's going to be, site specific. COVID-19, according to Oregon Health Authority, at this point, it is recommended but not required. Again, if that's something that your site requires, then you would have to do it. If you have had the vaccine, go ahead and upload that documentation and just, it's there if it's needed. So this is about a third of the list that most health profession students have to do. Most students have a whole series of vaccinations that they have to provide proof of. So it's relatively few items, and you can get through this in the next, 5 weeks or so. There may be other site-specific requirements. Peace Health, if you're doing an internship there, they may have some additional ones that include vaccinations or CPR or something along those lines. So again, where you are may add some additional items. For anything that you upload, make sure that your name is on it, the date. If you're uploading, say, the vaccine card or your flu shot, make sure that it's very clear where you got it, when you got it. All of that information needs to be on the documentation. Otherwise, it will get rejected, and you'll have to figure something else out for the documentation. American Data Bank should be contacted directly if you're having any issues with ordering services or uploading your documentations. They have a chat feature. You can email for support or call them. So the way that you get set up on Complio, again, American Data Bank is the company and Complio is this tracking system. So there's a link. So it's the laneccompliance.com. So that link will take you to this page where you can create your account, enter in all the information that's needed, and pay for the package. Without paying, I can only go to the first screen, but it's the usual kind of personal contact information kinds of information. This is the pre-background screening questionnaire. So you just need to say yes or no if you've been convicted, imprisoned, been on probation or parole. There are things that you can omit. But if there is anything that will come up, please put it in here. Because if I get a flagged background check, this is where I will go first. And again, most of the flags that I see come up, and I work with 4 different programs, they're usually pretty minor and are not problematic in any way. For the trainings, you can get all 3 trainings. So if you want to go ahead and do the OSHA bloodborne pathogen training, you can. It's not required to upload into Complio. Just the OSHA and the HIPAA trainings are necessary there. And so there's some instructions about how to go about it. Basically, when you go to the Moodle homepage, do not log in. Instead, scroll down further to where there is a search category. And for the search, what you'll put in is health professions training. And that will bring up the HIPAA, the bloodborne pathogen, and OSHA safety trainings. Those are updated every couple of years. So, if it says, I think this one is saying, 2021 or 2022, no worries. It just gets updated every once in a while. It's not every year. So once you get to that point, then log into Moodle and you'll be able to take the trainings. The trainings are about around half an hour, 20 to 30 minutes generally. You can take the quiz at the end as many times as you want or need to. But it's pretty, if you're listening carefully to the training, it's pretty straightforward to just take the quiz and then you'll get a certificate. And it's that certificate that you will want to save and then upload into Complio. I want to give you 2 views. So your student view of Complio will look something like this. And it will have all of your requirements. So this is showing the pre-background check and the certificates. I just took that one page. And so both of these are completed. And so, it gives you the date, it has the document there. And if there's any reason that it's been rejected, there will be an administrative comment telling you why and what you need to do. Sometimes students get the wrong documentation uploaded, and so it's a matter of just getting the right one uploaded. And sometimes it's for other reasons. Maybe your name wasn't clear on it, or so they will tell you if it's rejected, they will tell you the reason. And if you can't figure it out, you can always contact me, email me, and I can go in and try to help you figure it out. This is what I see on my end. So I will see the list of categories and which ones have been completed, the green check marks, which ones still need to be completed. And it gives information about it was uploaded, it was, the company reviewed it, it meets the requirements, they indicate the date, and down here is a status. So if it's pending review, it will have a yellow exclamation point. That's what I'll see. I'm not sure what you see on your end, but I see yellow exclamation points for anything that's pending. And then the status here is meets requirements. If it might also say does not meet requirements or rejected, and I will also see the administrative note. So that is Complio in a nutshell. Let me see, bring this back up. So is there anything that anyone has a question about?
I have a question.
Yeah.
Um, so I work at Peace Health. Can I get copies of my vaccinations and stuff like COVID-19 and the other stuff, or do I go to like downtown? I know they have a place downtown Eugene where you can get copies. I'm not sure.
Yeah, so documentation, if you've got the vaccine card, if you've had vaccinations through your doctor's office or through Peace Health employees, whatever documentation you have, you can get copies and upload that. There is also an alert, a state, it's called the alert system. And because vaccinations, aren't necessarily required, I didn't put the alert in here, but there's a form that you can fill out and get all of your vaccinations from the state of Oregon if you have them done here.
Okay.
So if you need that, I can send that to you.
You just look up the alert system?
I have the form, I can send it to you.
Okay. Easier, huh?
For some people, the alert system is easier. For others, they already have it, through their medical provider. They can easily get records, but it works pretty well for those who have their vaccinations here in Oregon. And the COVID vaccines would be in that system.
Okay. That's good to know.
Any other questions? Okay.
Is the when you upload your papers onto what is that called again? You're going down
The Complio.
yeah. Is there like a place where it says upload your documents on there?
It does.
Okay.
Yeah, and one thing I would say about uploading anything, scans, PDFs, are best. So I would scan any documentation you might have rather than just taking a picture of it. If it's on your phone, there is an Adobe Scan app that works really well. I use it myself. It's one that we recommend to students, for scanning in documentation and having it to be able to upload. So it works quite well. But photographs generally do not transfer well. They're often dark. There's sometimes the paper is crinkled, information can be hard to see. So we highly recommend either PDFs or scanned PDFs.
Okay.
Okay, well, let's stop sharing there. Rick, okay.
Here we go. I was just unmuting myself. Okay, so just a couple of quick items here that I have, just a few. I've gotten some people asking if they can take it before the last term, before they graduate with a degree or certificate. And the answer is no. We'd like you to take it during the last term. The sites that we have contracts with have expectations of things knowing, and I think you will get a lot more out of your co-op experience if you take it during your last term. Another question about available sites. I have good news and not so good news. The good news is we have a couple of sites that will be able to be offering remote co-ops, so you won't have to travel anywhere. That's a plus. For those of you who have your heart set on working at Peace Health or Lane County Public Health or volunteers in medicine or what have you, that may or may not happen. I'm still waiting to hear back from a couple of sites about whether they'll be able to take some. Some of them are going to a new electronic health record system upgrade, so it's really not a good time to have students. Some of them have space issues because they're moving departments and one thing or another. So we'll do our best to accommodate people, but I want to be very honest and straightforward with you about it. It may not be possible to give you your first choice. Only other things that I have, as some of you have found out, you need to contact me so I can get you enrolled. Right now, HIM 280, you need my permission to enroll. So email me and then I'll work it out with the co-op office and they will give you an override so you can go in directly. You don't have to bother Kathy Torvik. She's got plenty to do and what have you. So reach out to me directly and we'll get you going on that. Then the only other thing is there are some Moodle assignments that you need to do. You need to track your hours for one. You need to do some surveys and write a few assignments. Nothing that's a big deal. But I think the thing that I find is that sometimes students get so carried away and so motivated and really are getting so much out of their co-op experience, they forget, oh, I have to track my hours and actually turn these things in. So just a little note about that. And then glad to answer any questions that anybody has. And Carrie, say hello to your little boy for me. How old is he, by the way?
He'll be 5 in just a few days.
Very good. All right. Terrific. Well, do we have any questions? I want to make sure everybody gets gets an opportunity to ask questions.
Rick, were you gonna go over the co-op handbook?
We could. Do you have it handy? I was going to just email it to them myself.
Okay.
We can.
Is anybody wanting to see that right now?
Why don't we bring it up and just go through this highlights, Kathy? I think that might be helpful. I don't have it
Okay.
at my fingertips. I can dig around for it, but if you have it handy, that would be great.
Let me see. Um, Okay.
Okay, you have it?
Mhm.
Okay.
Although I might have an old one here, but just
Okay.
date wise.
Hold on, let's.
Yeah, this was. Oh, I'm sharing my screen.
Okay.
Let's stop sharing a moment because I lost it.
No worries. I'm sure I can find it if you don't have it.
Yeah, it says 23-24, but the date on the top.
All right. Let's go with that. I'll hit the highlights and we can do the
Okay,
cosmetic stuff We're still looking at your drive
You
at
are?
your file explorer, Kathy.
That's interesting, we have it up. Um. You don't see it there?
Nope.
Okay, because I see it on my screen. I'm not sure how to do that then.
Just stop and do a new share is what I would recommend.
Mhm.
I got my questions answered. But
Okay, that sounds good. If anybody has any other questions or something, comes to mind later, you're more than welcome to reach out. And what I'll do is make sure that we send that, but in brief, it's pretty straightforward stuff. You do have to do 108 hours of supervised work in a HIM department. If you're like Serena and you're already working in a facility, that is fine, but it has to be separate from whatever the scope is of your paid position, if that makes sense.
Mhm.
That's a KHIM requirement. That's not a Rick or a Kathy requirement. The scheduling, it's 108 hours. You can do it anytime within the parameters of the spring term. That means that's between you and the site. You do need to track your hours. You do need to complete the assignments. And, as soon as you register for the class, it'll be HIM 280. You'll be enrolled in it just like anybody else. So any of your other Moodle courses. So pretty straightforward stuff. If you have particular preferences or you really want to get involved in registries or, coding and reimbursement or something, or you want to work at Slocum, which unfortunately is not an option this term, was last year, but they can't accommodate us this term. Please reach out to me as soon as possible and let me know. It's also useful if you can send me a resume. I've only had one site that hasn't asked for it. So if you have one, please feel free to email it to me now so I can start working on that. And that's about all I have. Any other questions? I'm not used to a quiet group.
Sorry. I'm just
oh,
I'm taking notes over here at the same
Okay, so key things, it's 108 hours. That's about 10.8 hours a week. A question I got just a little while ago from somebody who's planning it. Do I have to do them all at once, like a regular 40-hour a week job? No, it's totally between you and the site. You do need to log your times, and there'll be a log sheet that you'll have to put that in there. Okay. But that's between you and the site. People want to know, can I work weekends or after 5? Again, same thing applies between you and the site. Just track your hours. Okay.
all right.
Do you guys have like a certain place that you take us, or do we choose?
If you have a preference, reach out to me and we can talk about it. Some people's preferences, I'll tell you right now, are not available. I had one person who's very set on he wants to work for Lane County Public Health. Unfortunately, it looks like he may very well be disappointed. It doesn't look like that's going to work. Slocum is another one. And that's unfortunate, but we have more than enough spaces that have reached out and said that they will gladly take one of our students.
Okay.
I have a
So
question.
that should work out fine. Go ahead, Carrie. Didn't mean to cut you off.
I don't know. In your opinion, do you think a remote position for the internship you would get as much as if you were actually at the facility? What would your opinion on that be?
I'm of two minds of it. I've seen them work either both really well. If you have a manager or supervisor who's very hands-on, is having people do stuff, then I think it's really, it can be a good thing. On the other hand, if they're just going to have you read policies and procedures and what have you, I don't think you'll get a lot out of it.
Right.
But in truth, more and more jobs are going remote in health information management. In fact, like from time to time when I'm prowling Indeed and some of these recruiters, there are a number of different things that are coming up that are remote. Some of them are still on site, and I'm going to be posting one at Peace Health that's going up shortly. But that's on site. But more and more of these jobs are going remote because if you really think about it, the more staff they can have working at home, that frees up hospital space so they can have a procedure suite or, you know, a cast room or something else. So the days of health information management being relegated to the basement of a medical center are kind of being a thing of the past. But
Right.
there are still a few sites that have paper records, and you know, truthfully, I wouldn't be opposed to that. It's a great way to learn the HIM workflow and see the whole picture that you might not get if you're doing a remote internship.
Right.
I hope that answers your question.
Yeah, no, absolutely. Thank you.
Anytime. Anybody else? Serena, you're unmuted, so that means you're probably about to say something or
So
ask something.
where are the are they like clinics or what type of places are we going to be doing our internships and co-ops?
One possibility is Kaiser Permanente. Suni Borghi is a member of our HIM advisory committee. She's graciously offered to take some students. Peace Health, I'm still waiting to hear back. Nothing personal. I know they're busy over there, so I don't want to be too much of a nuisance, but I did reach out to them and I haven't heard back. Slocum is a good one. We just started using them last year. Unfortunately, we won't be able to use them this year. And Lane County Public Health. So they run the gamut. Some of them are clinics. Some of them are medical centers like Peace Health Riverbend. Some of them are large organizations like Kaiser Permanente, and some of them are smaller. So, you know, if you have a preference, this is your time to reach out. Otherwise, I'm going to assign you, you know, based on where I think you'd be a fit. Some students don't really care. Just get me a place so I can graduate, and that's fine too.
I don't know. I just want to see where. I don't think I really care because I want the experience. I want the hands-on experience. So I'd rather go and be right up front because I work better that way.
Okay. I totally understand. We'll do our best to accommodate you. And if you have a question or a concern or a preference, think it over and get back to me.
Okay. I'm
All
sure it's
right.
going to be a while because I think that my program, I just signed up for 160 and 125. So it's not going to be for a while until I actually get into the co-op part.
Right. But it's good information for you to have. But Kathy and I just had a conversation a few weeks ago that if we tell people all these things about co-op straight away at the first orientation, when they first take the intro class or something, inevitably we'll have some people who sign up or they forget that they do it, or they start assuming, well, now that I'm doing this remote co-op, I don't have to do all this stuff. And then things start to come off the rails a little bit. But it's good you're here. We're glad to have you. And this will be a good opportunity for you to take this information in, and then another year, whatever it is, we can revisit it and get you going. But at this point, I wouldn't have you do your Complio stuff right now and just have it expire.
Yeah. It's good to know this information though. I appreciate you guys telling us.
Well, thank you. Kathy's doing a lot of the work here with Complio. I do dabble in it, but she is her and her colleagues downstairs are the Complio experts. I'm just the amateur.
Hey, you're here.
Pardon?
Said you're here, you're helping.
Well, but Kathy's doing the lion's share of it. So anyway,
Thank you guys.
well, you're very welcome. Do we have any other questions? Okay, thank you so much for your time.